Hey everyone, it's Dr. Bacala. I wanted to teach this mnemonic that I learned in residency, and I actually still use it to this day as an attending physician. And it's a mnemonic I use for all my diabetic patients, and I just run through this in my head, and I'm able to cover a lot of things and do a good job. And the mnemonic is called GLUCOSEBAD. So let's get into it. We'll see you guys at the board, all right? All right, everyone. Welcome to the board. So, the mnemonic I was talking about is GLUCOSEBAD. And again, I use this mnemonic at the clinic to help me take care of my diabetic patients. It's a good tool to use to cover a lot of information in a good amount of time. Because as you know, in the clinic, we have to see a lot of people, a lot of patients, and we also have to be very efficient as well. So it's a good way to stay on track and also do a good job with our patients. So let's get into it again. So it's called GLUCOSEBAD as a mnemonic. So let's spell that out. So G-L-U-C-O-S-E. And that's your, glucose, right? So, and then now BAD, B-A-D. So GLUCOSEBAD, all right? So G stands for glycemic control. So glycemic control. So you want to make sure you're looking at their hemoglobin A1C. The goal is less than 7% because that's a controlled diabetic. You're also looking at their glucose logs. If it's, preprandial should be between 80 to 130. Their postprandial 2 hours should be less than 180. So you want to make sure that you're reviewing that, right? The next one is L. So that's lipids. All right. So lipids is make sure that you've ordered a cholesterol panel, a lipid panel, and the goal is LDL less than 100, right? So this is also the time I give education regarding exercising, following an appropriate diabetic diet, low carb, and also a statin. This is the time I say, hey, if they're not on a statin, I recommend putting them on a statin or discussing that, right? So that's L. U is urine. All right. So make sure that we're looking at their urine as well. We're looking for proteinuria. We always like to order a microalbumin urine to make sure that there's no possible renal damage or nephropathy developing, because that's very important to follow as well in diabetics, right? So next one is cigarettes. All right, so I might have spelled that wrong. So cigarettes, if they're a smoker, tell them to quit. It's very important that they quit smoking. Smoking and diabetes is a bad combination. It increases the chance of heart attack and stroke or cardiovascular events by a whole lot. So we want to make sure that we're educating our patients to quit smoking if they smoke, right? So O is ophthalmology. Ophthalmology, all right, we got to spell that. I don't know if I spelled that right. But anyways, ophthalmology. So it's very important that our diabetic patients are seeing the ophthalmologist annually to evaluate their eyes for any retinopathy, right? So and again, type 2 diabetics, it's annually recommendation, and type 1, it's typically every 5 years. But we just want to make sure that they are seeing their eye doctor and they're getting evaluated for that. S is sexual dysfunction. All right. And for this, most of our diabetic patients are, may have some sexual dysfunction, especially our MIN patients. There's issues with erectile dysfunction, and it's just a discussion you want to talk about. Consider, if they're able to, you could consider sildenafil or tadalafil, something like that. Just you want to make sure you bring it up because that's important too. And then E is extremities. All right. So extremities is also important too. You want to make sure that you're looking at your patient's feet, make sure that there's no ulcers. You want to give them appropriate education regarding, keeping their feet clean, just good hygiene, because you want to avoid any infections, again, ulcers. Also, monofilament testing is something we also have to do. So that's just, that's what E stands for, is extremities. B is blood pressure. All right. So blood pressure, very, very important that we keep our diabetics' blood pressure under control, right? So the goal is less than 1/4/90. I typically, especially my younger patients, I like them to be around 130 over 80 or below, right? So again, another discussion to have, and also you got to make sure these people are on an ACE inhibitor and ARB to make sure to have that renal protection and also just to help control the blood pressure. All right, that's very important. And then A is aspirin. Most of my patients are on aspirin. If they're diabetes, that's a risk factor. for cardiovascular events and things like that. So I always, recommend a baby aspirin for all my diabetic patients, unless it's a contraindication of something, a chronic condition they have that they can't take aspirin. But something very important to cover. And then D is dentist. All right. So I always recommend all my diabetic patients to see the dentist twice a year. I'm lucky if they do that. Once a year would be great. So always recommend the dentist, just because for diabetics, we want to make sure that they have good oral hygiene and they're getting that checked out, right? So that's the mnemonic. It's a really quick tool to use at the clinic. It's GLUCOSEBAD. I added another letter to it, and something for myself that I created is I added the I. So it's GLUCOSEBAD I now, right? So I is immunizations. So immunizations, it's very important that our diabetic patients are, that we're recommending that they get the, flu vaccine every year. And also if they're 65 and up, or they have risk factors or chronic medical conditions for a risk of pneumonia, we want to make sure that they get their pneumonia vaccines like the Prevnar, Pneumovax, right? And also just up to date all their vaccinations. So immunizations, right? So that's something to look into. Again, the mnemonic is GLUCOSEBAD, but I got excited, so I added an I, so that's GLUCOSEBAD I. But this is just a quick tool, like I said. Use it at the clinic. You'll do a good job, and it'll help you just take care of our diabetic patients in the right way. Anyways, thanks for listening. We'll see you guys next time.